Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, a doctorate prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. I'm very excited to introduce today's guest, Shauna Sandford, the lead nurse practitioner at Amethyst Wellness. Shauna obtained her nursing degree from the Denver School of Nursing in 2012, followed by a Master of Science degree from the University of Cincinnati in 2019. She started her career as a dedicated labor and delivery nurse and later transitioned into becoming a women's health nurse practitioner. She now specializes in hormone replacement therapy and brings a wealth of expertise in health and wellness to her role at Amethyst Wellness. Shauna was born and raised in Littleton, Colorado, and moved to Florida in 2022. Welcome, Shauna.
Thank you.
I'm so excited you're here today. Shauna and I met. We had an acquaintance in common, and I was looking to grow our team at Amethyst, and she said, I have the girl for you. So when we met, we just hit it off, and you've been such a blessing to our practice, and I'm so happy that you're here and here in the studio.
Well, thank you. I'm happy to be at Amethyst as well.
So today we're going to talk about hormones. So can you tell us a little about your background and how you came to specialize in hormone health?
I started in women's health, nursing, obviously delivering babies, but focusing more on the hormone aspect when I moved into an office role when I was going to start going to grad school. So I was working in a OBGYN office, a urogynecology office, and a gynecology oncology office. And I became passionate about hormones. So when I decided to go to grad school, I started working for clinicals in an OBGYN practice where they started doing pellets. So from the time I went to graduate school, I got to start working with a nurse practitioner who did pellet therapy. And I just dove deep into it and really became passionate because you saw how much it could help men and women.
Excellent. And that's something that's so satisfying in our practice. That it's a life-changing therapy. Now, you mentioned pellets. So you mean hormone pellets. So describe what a pellet is.
So a pellet is a delivery route for hormone replacement therapy. You can get testosterone, estrogen, and progesterone in pellet form, and they're for men and women. Men just get testosterone, but you can do different. It's a different delivery route compared to creams or drops or troches.
Excellent. And so is this your favorite method or does it depend on the situation?
This is a preferred method for me and for most of my patients because you usually will respond better to this form. It skips the liver and it's directly absorbed into the bloodstream. And so most of the time, patients are very satisfied and feel much better on a pellet form.
Very nice. So what we're going to do is talk about some commonly asked questions about hormones. So the most common question we get is it safe?
So pellet therapy has been around since 1933, and hormones have been out for a long, long time. They've changed and evolved, but it is a safe form of hormone replacement therapy. Anything you do comes with risks, benefits. So you always have to weigh that out, what's right for you. Each patient is different, but hormones can be safe for both men and women, and there's not really a lot of contraindications for testosterone replacement therapy specifically.
Excellent. So we do testosterone therapy for men and for women. What are some of the benefits to testosterone therapy?
Testosterone for women, we could start off with, is really good for muscle mass. It's really good for the brain fog, sleep, joint pain. Testosterone is the most potent natural anti-inflammatory that we produce in our lifetime. So it's really good for that inflammation in the body. Testosterone also is really good for bladder. So women will complain of urgency frequency, but your bladder is a large muscle, so the testosterone is going to help with the tone. It's also really good for libido, which is a big complaint in menopausal women, lack of. And it's also really good for some night sweats. Testosterone in men is really good for muscle mass, sleep, a lot of the same symptoms. Some men start to have night sweats, so it can help with that as well. If they have erectile dysfunction, it can help with mild erectile dysfunction. It can help with the brain fog component and muscle mass. The health promotion benefits for both men and women, it builds backbone density, helps maintain the muscle mass, which we really see a huge loss from 40 to 45, 60 to 65 years old, we lose muscle. And it's also good for prevention of cardiovascular disease from the inflammatory factors that.
I think people are really surprised to find out about all these health promoting effects. They think they need hormones for menopause or andropause, but the health promotion, I think, is just another thing that's life changing for people.
Oh, I agree. That is a big benefit from hormones. And yes, it's something people can do a long time for quality of life, but also for the health.
That's another question we get quite often is how long do I do this for?
So there really is no end age. You can start when your symptoms are occurring, or some women will come because they have osteoporosis and they don't want to be on medications for bone loss, so they'll start testosterone replacement therapy often 70s. There's even a couple people in their 80s for quality of life.
Yep. We have an 80-year-old skier in our practice, and we want to keep her bones strong so that she doesn't get hurt and she can do the things she wants to do.
Yes, so beneficial for bones too. So
yeah, and we've seen people have osteopenia, which is when the bones start to lose their density. We've seen it reverse on therapy, which is amazing.
Yes, it is. I had a radiologist call me when I worked in Colorado, and he asked what we were doing for a female patient because he had never seen bone gain in somebody her age, and told him we were doing testosterone replacement therapy via pellets. And he just said he was very interested and ended up sending his mom into the office.
Wonderful. So. When you think about mortality in older people, having a fracture is something that can really be the end of someone's journey here.
Yes.
So preventing that is just very, very imperative.
Yes, it is.
Yes. So we can also do estradiol therapy for women.
Yeah, so estrogen for women also has health promotion benefits. It prevents cardiovascular disease. It keeps the mobility, the flexibility of the vascular system. It's also really good at helping prevent colon cancer, and then can build back 3% of bone density as well. So, and of course, symptoms, helps with hot flashes, night sweats, vaginal dryness, atrophy. So it's beneficial as well.
Oh, wonderful. So the hormones that we offer at Amethyst are bioidentical. So what is the difference between that and synthetic hormones?
So I always explain synthetic hormones as being man-made, but pellets are man-made, but they are a plant-based hormone. Your synthetic, if you think back to Premarin as an estrogen replacement therapy, it used to be pregnant horse urine is how we used to make it. That is a synthetic version.
Gross, right?
Yes. And your plant-based, your pellets, are going to look more similar to your natural molecules as, they respond better. Your body will absorb them better because they are plant-based and look closer to your natural molecules of estrogen and testosterone in your body with less side effects.
So another really common concern we get is from some practitioners of traditional medicine, and some are really opposed to hormone therapy. So why do you think that is?
I actually think it's just the lack of education. I think hormones is a specialized, area to focus on, and I think that they just have not spent time focusing on hormones, the benefits. I really do believe it's the lack of knowledge. Because we had done terrible studies in the past where we've given women all this estrogen, they hadn't had any in years, and then we saw a rise in breast cancer and endometrial cancer. But we've learned from that study alone, and hormones is forever changing, and we're learning so much more all the time, and the safety and health promotion pieces of it.
Yep. And that study came out, the Women's Health Initiative is a study, and I was in grad school in a women's health class when that study came out. And I think I saw it before my instructor did. And back before that, I had worked in ICU, and every woman that had a heart attack was put on synthetic hormones because we thought that's what we were supposed to do. And
Yes.
I was like, wait, what is this? It was completely different from what I had been taught. And I think the whole medical community responded in confusion.
Yes. And then they just wanted to stop estrogen, and estrogen was a bad hormone, and testosterone really for women hasn't been studied very well. So, but it was a horrible study.
Right.
So,
One thing that is exciting, the makers of BioT, that's the brand we use, did come out with a study that showed a decreased incidence of breast cancer in testosterone users, bioidentical testosterone users. So not only do we feel it's not harmful for you, but it may even help.
absolutely. I had a breast surgeon in Colorado. She worked downstairs from our OBGYN practice, and after treatment for patients, she would send them upstairs to start testosterone replacement therapy for prevention of reoccurrence.
Wonderful. And that is something we can offer. Often when women have had breast cancer, they're told no hormones and they're miserable. They feel so bad, but they actually can receive testosterone safely. And there's just a way that we do it for them.
Yes.
Okay, so we talked about the symptoms that suggest that we need the hormones.
Yes.
A lot of times people say, will I feel like myself again?
So I tell women and men, we won't make you feel 20 again, but we can absolutely help you feel a lot of the emotional components that come with menopause, andropause. That piece we absolutely can help. You will feel much better. Almost 99% of people, I would say, respond to a pellet form of replacement therapy to feel normal again.
Yeah, it's the emotional component. When people do come in for their original consult, we have a box of tissue sitting right there because they just start opening up because they feel so bad and they've been told, oh, there's nothing we can do. There's nothing wrong with you. And they're like, but I don't feel good.
Yes.
So it's so exciting to be able to offer them something that'll help them feel better.
Oh, yes. Almost always, I feel like for the emotional part, they will feel so much better.
Yep. Well, good. How long does it take for them to feel better?
So after your first pellet, women will peak, feel the best, usually about 5 to 6 weeks post pellet. Men feel the best about 4 to 5 weeks post pellet. And then, depending on how much working out you're doing or how much you're using your cardiac muscle, your heart, is how long you're going to get pellets to last. So, men are usually between 4 and 6 months, and women are about 3 to 4 months.
We find our more active people tend to go through them a little quicker.
Yes, they do.
They're using them up, but they tend to feel really good.
Yep.
So how do we administer these pellets?
So pellets, we find a patch of fat somewhere on your body, typically above your glute, and we put the pellets into the fat tissue. We don't need to suture the area. We just use some steri strips to keep it closed, and it's a pretty easy process with very little downtime, if any.
Oh, wonderful. All right. So do you find that it helps with weight loss?
So I often tell people, men, when they get their first pellet, they can lose somewhere between maybe 10 and 20 pounds in their
Wow.
first pellet. Women, it doesn't end up like that,
Of course not.
unfortunately. They usually, by about a year, you can see some weight loss on scale because you're building more muscle mass. So you still have to do the work. You still have to put in the, working out, but you'll build muscle mass, which more muscle mass will burn fat. It just takes longer for women.
Yep. And it's more important for your health, too, to have that muscle for injury prevention.
Yes, it is.
Yeah. So hold that thought. We are going to take a short break to thank our sponsors. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, and my guest today is Shauna Sandford, the lead practitioner at Amethyst Wellness. Before the break, we were talking about commonly asked questions about hormones and specifically about weight loss during therapy. And you had mentioned that men many times lose weight right away, but women don't. Why is that?
So the last conference I went to for BioT, they discussed about checking a hemoglobin A1C, so your glucose levels over your past 3 months. And they had noticed that men respond better in decreasing their hemoglobin A1C or insulin resistance compared to women. There was not an exact answer behind why men are going to lose more weight typically than women, but testosterone also helps with perfusion of blood to many tissues, whether it's your brain, your breasts, your prostate. And so your liver is getting a better perfusion as well. So I'm not sure if that contributes, but men definitely will see weight loss often before
Right.
women will.
Just like men lose weight on keto before women do
Yes.
and all that stuff. We also find, though, that when people are feeling better, they're more likely to go to the gym and to do the things that are going to support their goals. So that can be helpful, too.
Yes, absolutely.
Yes. So we talked about all the amazing benefits of the hormones. So what are some of the side effects?
So, side effects in both men and women, we see acne because the natural oil production in the body that occurs with testosterone. And so, we do have a way to combat that. We typically have anybody who uses pellet therapy to take DIM, which is cruciferous vegetables compounded into a supplement, and it prevents acne. And it also is going to keep the men from converting their estrogen or their testosterone into estrogen. The other side effects, you can have some facial hair growth, so not creating a mustache or beard for women, but they can get little black hairs that pop up that require some laser removal or some plucking. And then if we give you too much testosterone or you do end up being a person that's converting your testosterone, you can have male pattern balding. It's not something that happens overnight. We check in on that and make sure you're not having that with your pellet therapy. And if so, we reduce your dose and can help. But really, the side effects are minimal compared to the benefits that you get.
Excellent. So testosterone, for example, is a hormone. And all hormones will go down different pathways and become different things or have metabolites. And that's how some people will make some estrogen from their testosterone, which for us ladies is usually a good thing because we need a little bit of that. For the guys, if they make too much, it's a process called aromatization.
Yes.
And not every man does that, but some do. And we have treatments for it if it does happen.
Yes. And it also will prevent you from feeling as well if you're converting your testosterone into estrogen, especially for men. So
Yep. So is there anyone who's not a candidate for therapy?
we really haven't found anyone who's not a candidate. Sometimes we need clearance for, any history of cardiovascular disease or open heart surgery, or if you've had a history of breast cancer that's an estrogen dominant and you need estrogen, then we often need a clearance. The only contraindication would be if you currently have prostate cancer or have prostate issues, and it doesn't mean you can't do it, you just need a clearance from your urologist oftentimes.
Right. So that brings us, how do we know how much somebody needs and or if there's an issue?
So we actually take a lot of things into account. We'll do an extensive, visit going over your history and your medications and your surgeries. And we basically find out how much you're working out, what's your cardiac output, how much do you weigh, and then getting your labs. So after we get a big panel of labs, we're going to see a pre-pellet hormone level, and we can kind of decide at that point what dose of testosterone and estrogen you need. And then about anywhere from 4 to 6 weeks later, depending on male or female, we get labs and see if we need to make any adjustments to that dose.
Yeah. And I think those lab tests are so important. One, to detect, let's say we have a man who has a hidden prostate cancer and doesn't know yet. It's so important to have those labs first before we give him anything.
Absolutely. We don't want to give somebody with prostate cancer testosterone because that's what feeds it.
Right. So screening is very important. And then the labs after, and that's how we determine if we got it right, because everybody's different. Everybody metabolizes differently. So that allows us to say, okay, well, one, how you're feeling, right? But then we have those metrics, and we can get it right most of the time.
Yes, we can. And that's correct. Not everybody has the same dose, which is the nice part of pellets is we can really make it an individualized plan for each patient.
Yep, yep. And I think as far as safety goes, when people say, is it safe? Well, the way we do it, I think it's pretty safe
Yes.
because we are checking those things and we're being very vigilant for their health.
Yes. Yes.
So if somebody is interested in pellets, how do they get started?
So they can call Amethyst Wellness and set up an appointment for a consult. Anybody can consult. We're just going to order that blood work. We're going to go over your history and educate you and kind of debrief so that you have a pretty good understanding or basis for what to expect and your hormones.
Because some people don't know what they need. They just know they don't feel good. And is it your hormones? Is it something else? Well, we can find out. It's that first step.
Yes.
Excellent. Okay, so now we're going to talk about some myths about hormone therapy. So, number one, if your labs are normal, your hormones are fine.
So that is not correct because we're treating the patient, not the labs. So we still check your labs, they guide us, but that is not an end all for why you're feeling that way because your hormones and levels change all the time.
Yep. It's a particular issue for women in perimenopause. So before they stop menstruating, that period of time can go on for 10 years or so, and people don't feel very good during that time.
No, they don't. And your labs will look normal. It will say you're a menstruating female on the lab results, but really you're like, I really feel off and this isn't my normal self. So labs are not the only way to treat a patient.
Yep. And that leads us to number two, hormones only matter during menopause. So we can treat perimenopause as well, and that's very important for people to know.
Yes. Often it's testosterone replacement therapy, and you don't always need estrogen as a woman in perimenopause, but we absolutely can treat you. And again, it's individualized, so different for everyone.
Yep. Wonderful. Number three, low libido is just a part of getting older.
So it is a natural part of life, but it is absolutely not necessary to live with that because it is a quality of life. That is libido. It comes into play with connection with our spouse or, there's many things you gain. You gain mental components that are healthy, for the brain by having intercourse and the connection piece, but you will naturally lose that drive or desire, but we can help you with that. That is absolutely a quality of life.
Yep. And so many of my clients will come in and say, I really do love my husband, but I could care less whether we ever have sex again. And
Yeah, we hear that all the
yes,
time.
Yes. And so, we fix the hormones, we get people feeling better. And it's not just the libido. I think it's just if you feel better overall on the inside, then women are emotional creatures. So
Yes,
we are more likely to want to be intimate when we feel better about ourselves.
Yes, I agree.
Yeah. And then the husbands feel happy with us and keep sending their wives in.
They often will know when you're due for your pellets, and they'll make sure that they will be the ones paying for it as well.
Yeah. So you mentioned that the hormones can help men also with erectile dysfunction.
Yeah, so a lot of that comes down to the increased blood flow to different tissues in the body. And so sometimes men will have erectile dysfunction, but it's very mild and they don't want to take, medications that help with erection. Testosterone for mild erectile dysfunction is a great option. And we also have alternative things to help if the erectile dysfunction is, moderate to severe as well.
Right. And that's important too for people to know that it's a very common issue and there are things we can do about it. And there are different compounded medications that are very well tolerated that can help if the testosterone isn't enough.
Yes.
On its own. And so we talked about the supplement DIM to help with healthy hormone metabolism and to prevent side effects. Are there any other supplements that you recommend?
So often we always recommend vitamin D. And you should, when you take vitamin D, it was originally, brought up that it helps a lot with bones. So you need K2 with your vitamin D. And then B12 is an important supplement for energy and immune system. So that's another supplement that we recommend.
Excellent. And, and we do the labs that help guide those recommendations as well.
Yes. Yes.
And so we're almost out of time, but we didn't mention the thyroid, which is probably going to be another episode. But briefly, that is something we check as well.
Yes, we check your thyroid in 4 different views. We look at more than just a TSH, which is the main level that most providers check. So we're going to look for antibodies and look at your T3 and T4.
And sometimes I find that's the missing link. We get people feeling better, but they're not quite there yet. And sometimes optimizing that thyroid function is just that piece that gets them, to where they want to be.
Yes, with energy and brain fog and joint pain, it helps with that as well. So,
yeah. All right. Well, I want to thank you for being here and sharing all this information. And, to our listeners, if you would like to get to know more about your hormones and see Shauna or one of our other practitioners, check out our website, amethystwellness.com, or give us a call.
We would love to help you. Thank you for having me.
Thank you. So thanks again to our listeners for tuning in to Energize and Revitalize with Dr. Amy. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live your healthiest, most energized life. Until then, stay healthy, and here's to your best life.